All right, so today we are going over Put It All Together Unconscious Assessment. So this is CPR for someone going through cardiac arrest. This is my adult. So here we go. Some symptoms of cardiac arrest are discoloring of skin, nausea, tingling in arm, back pain, chest pain. Sorry, my dog's coming in and out. So where we want to locate where to do compressions is going to be in between the nipples on a victim. So we'd like kind of go through here, we'd go up. There's a little spot that's missing some bone there, and we go up there a little bit above there, a couple inches, and then we go here. We'd want our shoulders above our hands, the palm of our hands like this, and we want to go 2 inches deep on an adult, 2.4 inches at deepest for an adult. So we're going to be doing that. One thing you might have heard is staying alive. That's a very common method of a time method that people use so that they can do it to 100 to 120 beats per minute. So yeah, and the purpose of CPR is keeping the cells alive in the body by helping oxygen-rich blood continue normally, because we can't really bring them back. Well, it's more sustaining them until proper EMS or what's it called? EMS or like first responders are there. So let us start. Okay. And again, cardiac arrest is no pulse, no breathing. And this is an unconscious victim, is how we're doing this one. Okay, so this is an adult. We come upon the scene. From initial impressions, we gotta make sure it's safe. It is safe. Put on our gloves. Grab our pocket mask. Mine's already put together, but probably wouldn't be for you in the situation. So we're gonna come up to them, go to their shoulder, tap on their shoulder, go, "Are you okay? Are you okay?" Do that 2 times. No response equals implied consent at this point. We point to a bystander. "You go call 911, get back to me." So then from there, we go to open the airway, tilt the jaw back. We're gonna lean down, look, listen, and feel for breathing. So we're listening with our ears here. We're feeling along the jugular. We want to bring it back a little bit like a Adam's apple, go a little bit down the side towards us, and we're gonna look for the chest rising for no longer than 10 seconds. So we go 1, 2, 3. So what we find is there is no pulse and there is no breathing. So now we go to put in the pocket mask. So we want to do it nose this way, because the pointy face goes over nose. Cover this. We want to tilt the head back. It goes a little bit further back for adults than it would a child or an infant. And we're going to put in 2 ventilations. And we want to make sure that the chest rises with the ventilations. So we're going to find from here that the ventilations do go in. So what we find is no pulse, no breathing, yes, 2 ventilations. So we have to start CPR for adults. So here we go. Okay, so we're gonna put the palms like this, go over, and we're gonna go 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, and 13, 14, 15, 16, and 17, and 18, and 19, and 20, 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 30. And we're gonna go back. We're gonna do 2 more ventilations. Looking at the chest to see if it is taking ventilations. We find that still no pulse, no breathing, but the ventilations are going through, so we're going to do that again. So we're going to go 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 1 and 2 and 4 and 5 and 6 and 7 and 8 and 9 and 20 and 1 and 2 and 3 and 4, 5 and 6 and 7 and 8, 9 and 30. So we do not stop CPR until we see obvious signs of life. Another trained citizen responder shows up and takes over. A first responder takes over, like a fireman. AED is available, which is like the shocks, you know, like the clear sort of thing that we see in the shows. A do not resuscitate order, which is where we would let 911 know that we were given a DNR, which is do not resuscitate order. We have to call 911 back for that. We are too exhausted to continue, or scene becomes unsafe, which is where we would move this person with us to make sure that they too can stay safe, and we would continue again with CPR. So then after this is child. Child is 1 to 12. So for a child, the depth is 2 inches, and you don't get as big of ventilations or tilt the head back as much. So we're gonna do our initial impressions. We're gonna come across the scene. We gotta make sure it's safe. It is safe. We're gonna put on our gloves, and we're gonna grab our pocket mask. We're gonna come along the scene. We're going, does anybody know this child? Does anybody know this child? If someone comes running, we need their consent to continue. If no one comes running, it becomes complied consent. So we're gonna go up to the child. We're gonna go, are you okay? Are you okay? No response. Now it is implied consent for us. You call 911 and get back to me. So we're gonna open airway. Listen, look, and feel for breathing for no more than 10 seconds. All right. So then we're gonna give 2 ventilations. Seal the pocket mask on the face. Check to see if the chest is taking it. Oh, hi, Scipio. Hi, buddy. Can you go? It's okay. 2 ventilations take. Alright, and again, we check for no longer than 10 seconds. No pulse, no breathing. Yes for 2 ventilations. So now we're gonna do 30 of these. And then we're gonna give 2 ventilations and repeat. So we're gonna go 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 1 and 2 and 3 and 4 and 5 and 6 and 7, 8 and 9 and 20, 1 and 2 and 3 and 4, 5 and 6 and 7 and 8 and 9 and 30. So we're gonna put this back on, give 2 ventilations. Again, always looking to make sure that the ventilations are taken, and we would repeat another 30 compression to the chest, and we continue that until again they show visible signs of life. Someone comes to relieve us of our position who is qualified to. We are given a DNR, do not resuscitate. AED is available, or the scene becomes unsafe. And now we move on to infant. So infant, when you come across the scene, goodbye pillow. Come here, you infant. There we go. You want to tap the bottom of the foot and shoulder. That's the difference. And you want to use 2 to 3 fingers when doing compressions to the child. So let's get started. So we're going to come across the scene. The scene is safe. No danger. We put on our PPE, our gloves, and we grab our pocket mask. Now again with children, we flip it upside down to put it over to seal over the face. All right, so let's get started with those fun tips. Okay, so come across the scene. Does anybody know this infant? Does anybody know this infant? Someone comes running. We have to get their consent. If no one comes, it equals, or if no one comes and claims the child, it gives us implied consent. So we're gonna go up to the child, tap the shoulder and the foot. Oh, hi, buddy. Get out of here. I love you. Sorry. Alright. So then we're gonna... Sorry, 1 sec. So we're gonna come up here. We're gonna tap the foot and the shoulder. And we're gonna go, baby, 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 baby. Are you okay? Are you okay? No response. Victim is unconscious. You go call 911 and get back to me. And we're gonna start... We're gonna tilt the head back a little bit. You don't need to tilt it like you would an adult, a child. You only do a little bit of a tilt for here. We want to go, we want to check for the arm, for the pulse, and do this basically. So we still listen here and look this way, but we get pulse on like the arm vein. All right, look and listen for no longer than 10 seconds. 4 and 5 and 6. Hi, boys. 10. It's okay for 10 seconds. Alrighty. Okay. So, I'm sorry. I got a little flustered. Alright, so when you're doing CPR care for a baby, you want to put, we're going to check to see if ventilation's going. 2 ventilations, remember, like a child, you need to give less air, you give less deep of breath. So with the child, with the infant, we'd give even smaller ones. To check and see if 2 ventilations went in. So yes, the ventilations went in, no pulse, no breathing. So what we're gonna do now is we gotta support the child's head and put 2 to 3 fingers here, again, between the nipples. And we're gonna do 30 compressions, and then we're gonna check again to see if ventilations go through. So here we go. So we go, we're gonna start now. So 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 20. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 30. Head to the tilt again. Get 2 breaths. And then we would repeat with 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 until we see signs of visible life. Someone comes to relieve us of our position who is qualified to do so. Given a DNR response or command order, AED is available, or the scene becomes unsafe, in which we take the child in a safe way. So yeah, this is put it all together unconscious assessment. Hey buddy, I'm glad you got intrigued. Alrighty, so that's all. Thank you.